In 1811, a novelist named Fanny Burney had her breast removed while fully awake. No drugs, no sedation, just 7 men holding her down and a surgeon with a blade. She later wrote that she screamed so loudly she believed her voice would never recover. And here's the part that should terrify you, that surgery took less than 3 minutes. And she was one of the lucky ones. Because before anesthesia, the fastest surgeons weren't the best surgeons. They were the ones who caused you the least amount of agony before you either passed out or died. Stick around, because by the end of this video, you'll know the bizarre speed record one surgeon set that's almost impossible to believe, and the strange substance people believed could make you immune to pain, and why it absolutely could not. For most of human history, that's over 5,000 years of surgery, there was no reliable way to block pain. Anesthesia, as we know it, didn't exist until 1846. So how did people survive amputations, tumor removals, and even brain surgery for thousands of years before that? The answer involves speed, brutal restraint techniques, some surprisingly clever tricks, and a tolerance for suffering that modern humans can barely comprehend. Long before modern drugs, people experimented with substances to numb pain, with mixed, sometimes deadly results. Ancient Egyptians used opium poppy extract, but dosing was guesswork. Too much, and the patient simply died before the surgeon started. Medieval European surgeons used something called a soporific sponge, soaked in a mixture of opium, mandrake root, and hemlock. Patients inhaled the vapors, and if the mixture was strong enough, they'd lose consciousness. The problem, the line between asleep and dead, was razor thin. Hemlock is the same poison that killed Socrates. In the 1200s, some surgeons used a technique called nerve compression, literally choking a limb with tight bandages until it went numb from lack of blood flow, then amputating before circulation returned. It worked, sort of, but risked permanent nerve damage even if the patient survived. Ice and snow were also common. Surgeons in cold climates would pack a limb in snow until it went numb, a technique that predates modern cryotherapy by centuries and genuinely reduced pain signals. Because no pain relief existed, speed became the single most valuable surgical skill. This is where things get almost unbelievable. Robert Liston, a Scottish surgeon in the 1800s, was nicknamed the fastest knife in the West End. He could amputate a leg in under 30 seconds. That sounds impressive until you learn why. The faster the cut, the less time the patient had to go into shock or die from blood loss. Liston reportedly once amputated a leg so fast that he accidentally cut off 2 of his assistant's fingers and slashed a spectator's coat. The spectator, believing he'd been stabbed, allegedly died of fright on the spot. This surgery had an almost 300% mortality rate in that single instance, if the account is accurate: the patient, the assistant, and the terrified bystander. Surgeons trained for speed, the way athletes train for sprints, practicing on cadavers, timing themselves, competing with colleagues. A successful surgery wasn't judged by precision alone. It was judged by how fast the patient could be cut, sewn, and off the table before their body gave out from pain-induced shock. Before anesthesia, restraint wasn't optional. It was a formal part of the surgical team. Hospitals employed men specifically as holders, whose entire job was pinning patients down. Some hospitals used leather straps. Others simply relied on the sheer strength of 4 to 6 men. Patients bit down on leather straps or wooden blocks, not to protect their teeth, but to stop them from biting through their own tongues during the pain. One lesser-known detail: many patients described a strange phenomenon during surgery, a kind of dissociation, where the pain became so extreme that the brain seemed to disconnect from the body. Some medical historians believe this was an early, unintentional glimpse into the body's natural endorphin response, the same system anesthesiologists study today to understand pain thresholds. Here's the darkest part. Surgery before anesthesia was viewed as an absolute last resort, something you endured only when death was the alternative. Mortality rates for major operations often exceeded 50%, not from the injury itself, but from shock, blood loss, and infection afterward. Patients frequently had to be talked into surgery, sometimes sedated with heavy alcohol beforehand, not to numb pain, but simply to make them compliant enough to hold still. Then, in 1846, a Boston dentist named William Morton publicly demonstrated ether anesthesia during a surgery at Massachusetts General Hospital. The surgeon operating that day reportedly turned to the crowd afterward and said, "Gentlemen, this is no humbug." That single sentence marked the end of thousands of years of surgical agony, almost overnight. If this made your skin crawl, imagine living through it instead of just watching a video about it. Surgery went from a battle against your own body to a controlled, painless procedure in less than 200 years. And it's easy to forget how recent that shift really is. If you want more deep dives into the darker, stranger corners of history, hit subscribe, drop a comment. Would you have had the guts to go through with any of these surgeries? Let's talk about it below.